Hi, my name is Jeffrey Medina. I'm the licensed acupuncturist at Medina Wellness, and today I wanted to talk about a patient I had and I've talked about before. She had IBS-D, so just a little background on this patient. She had an umbilical hernia, had that surgically repaired, then had a random ab injury, and after that it seemed like her health took a turn for the worse. She was diagnosed with SIBO, was placed on antibiotics, had chronic diarrhea as a result, and then recently was diagnosed with a hiatal hernia, so a lot of abdomen discomfort, chronic diarrhea with swelling. So I saw her in June, and she was getting better, less swelling. By the end of the treatment course, her stool started to firm up. She had one normal bowel movement, and then she went home. And she was seeing a local practitioner there. Things improved a little bit, but she never really had normal bowel movements after that. In August, she came back to New York, and so we started treating again. At the end of the first week, she started having normal bowel movements. Second week, she got on a bunch of different supplements because it looked like she was starting to experience SIBO again. So certain bacteria were starting to grow in the small intestine. And she was placed on supplements. This caused a lot of bloating. It actually led to more loose stools and diarrhea as her body is trying to detox all of the bacteria. And so what we did that second week, we activated the immune system, but then we also regulated the rate at which the intestines function. So we would call that the gut-brain axis, and so that's going to regulate peristalsis and how the intestines move. So now we're in the third week, and it looks like for the past 3 days she's actually had normal bowel movements, and so we're starting to wrap up into our third week here, and then she just has one more week, and then she goes back home. But overall, things are improving, not completely healed, but we're making progress. And you should have seen how happy she was knowing her body can return back to normal.